Hi there, my name is Karen. I'm one of the pharmacists here at Powell Valley Healthcare, and I just wanted to go over today a few differences between the common cold and the flu. We're starting to see people come in with some of the cold symptoms and having some questions from folks about what is the differences and how do I know if I have the cold or a flu. And typically the common cold, it starts off with a scratchy throat. You might notice that little kind of an irritation in the back of your throat. And then it quickly moves up into your nose. You feel real stuffy, but it's runny at the same time. You can feel the mucus dripping down the back of your throat, and then that starts to make you cough. You might notice some mild aches and pains in your muscles, but not too bad. But you're feeling pretty tired because your body is trying to fight off the virus. There's over 200 viruses that can cause the common cold, and they can mutate quickly, and so that's why they are not able to come up with a vaccine for the cold. Whereas the flu, that typically hits you real fast and real hard. A lot of times you'll have a temperature of 102, even up to 106. And this contrasts with the common cold, where a lot of times you won't even be running a fever at all. If you do, it's usually mild, about 100 to 101. Also, with the flu, you really are just very achy. It seems to affect your whole body, whereas the cold seems to be mostly from the neck up. And if you do develop the flu, this can be potentially serious, especially for the very young or for the elderly, as it really does weaken them and can really make you feel exhausted. Some people say they feel like they've been hit by a Mack truck. Is a good example with someone who has the flu. There's not anything you can do to treat these other than just treating the symptoms that you have. And one of the things you can try is some Tylenol or acetaminophen if you're not allergic to that. That helps with the fever, also can help a little bit with the aches and pains. Nasal sinus rinses work really well to kind of help clear out that mucus out of your nose. And then you want to make sure to drink a lot of fluids because you can get dehydrated easy. A lot of people lose their appetites as well with the cold and the flu. Very important is to get your flu shot because this can help prevent the flu, and even if the flu virus mutates a little bit and you still get the flu because it wasn't 100% effective, it still does work to help lessen the symptoms. So if you have any questions, please give us a call or talk to your local pharmacist or come on in and see one of our physicians. You don't need to have any antibiotics, so they won't prescribe those to you if they think you have the cold or the flu because they do not work against viruses. Antibiotics only work against bacteria. So again, if you have any questions, stop on in, and hope you feel better, and keep washing your hands because that also helps prevent the transmission of the flu and the cold.